السلام عليكم ورحمة الله وبركاته. صبحكم الله خير جميعا. أبدأ بالشكر الجزيل للإخوان المنظمين والدكتور أحمد الصغير على الاستضافة الكريمة. I really feel proud and humbled and honored to be speaking to you this morning and to be part of this elite panel of speakers. I'm probably the youngest in the group. Dr. Khalid, Dr. Abdullah, Dr. Abdurrahman are our teachers and mentors, and I really feel a little bit awkward actually speaking to them. But there's something I wanted to just share and highlight and talk about in the spirit of engagement that we will talk about here. So the focus here is about leadership and uncertainty. So all of us feel that something is happening. There are changes. All of us feel that the status quo cannot continue. But almost none of us has a clear idea of what's coming on. And this is a forum for leaders, so I thought it's an opportune time to reflect on some thoughts and ideas about what do we do as leaders in a situation like this. And so very briefly talking about uncertainty in healthcare. Uncertainty in healthcare is an inherent feature of the enterprise, of the industry, of the service. This is something that we cannot eliminate. We just have to deal with and manage. The uncertainty happens at the level of the patient. Nobody knows exactly when they will get the disease or what kind of disease they will get. Nobody knows the response to treatment. At the level of organizations, all kinds of emergencies can happen. And at the level of a system, obviously, you can have crises and epidemics. And on top of that, the system itself is very much interlinked to the overall context, to the economy, to the policy, to technology, to societal trends, to changes in government, to education. It's all interconnected. This tremendous amount of complexity increases the chances of uncertainty, increases the chances of surprise. And if we reflect now on our current situation, we can see that there are changes, significant changes happening across all of these different contexts that we're talking about. The economy, things are significantly changing over the past 2 to 3 years. Nobody knows what's going to happen over the next 5, 10 years from now. The consequences of that on budgets for government institutions are not exactly clear. The consequences of that on private investment in healthcare are not exactly clear. Government, obviously there are changes in government. There's new leadership. There are new government entities. And policy, we also heard this morning the talks about proposals for change in the healthcare system. How is the healthcare financing model going to change? How is the delivery model going to change? What's the role of the private sector? Are we heading for more of a PPP model or a privatization or corporatization? All of this is still in question. What's going on with the healthcare education, with education in general? What's the impact of the policies of the past 10 years on the practice and the service over the next 10 years? That's also is an issue. Technology obviously is changing and changing quickly, sometimes in unforeseen ways. Both at the diagnostic therapeutic level as well as digital health solutions, as Dr. Rahman just pointed out. Possibilities for remote care and how that could impact the delivery of care. And again, the society itself is changing and changing quickly. Expectations of people are changing. We have issues and concerns that are developing. Some of them are related to our healthcare practice, like inequalities. And unequal access to services and variations in quality of services and things like that. And all these are expected to change as well. So you look at this and you see this is really almost a chaotic environment. And how can I, as a healthcare leader, deal with this? So this is the microenvironment. What we'd like to do next is relate this to us as leaders and think about the issues, the concepts, the points that we as individuals can do. So this is shifting the onus to a certain extent from, or shifting the paradigm to a certain extent from being reactive to the context to actually becoming more proactive and initiative taking. So I thought about what models should we use to address all these different points. And all of you know multiple leadership frameworks and models, but I came across the NHS healthcare leadership framework, and I found it really to be precise, comprehensive, and clear to discuss and explain. So I thought I'd just share this with you, and as we go, we can highlight points that are relevant to us here in the room. So at the heart of this is thinking of leadership as a process, as a distributed, let's say, act. It's not really an inherent or, let's say, an innate ability that someone is born with. There is definitely that tendency, there's definitely that talent, but leadership overall is something that could be trained, something that could be developed, something that does not just exist at the helm of the organization. It is something that should be at all levels of the organization. And this is actually at the heart of this model. This is one of the features that distinguishes this model from the rest, is that it is actually about distributive leadership. So all of us would have a leadership role, a leadership act that we can do to fulfill the requirements of the time, the requirements of the task that we have. So let's go through these steps very quickly and talk maybe about a few of them. So first one is about demonstrating personal qualities. And here I'd like to highlight maybe one point actually. So the issue of managing oneself before being able to manage others, leading oneself before we can lead others, is at the core of many leadership concepts and models. And this is, again, starts with developing self-awareness. So developing self-awareness is something that, unfortunately, we're not maybe used to in our culture. Self-examination in a way that leads one to realize their limitations, their weaknesses, lead them to actually examine their personal values, be honest about their personal values and what drives them to action on a day-to-day basis, is something that needs to be reinforced. And all the other elements will be around that. So managing yourself in terms of discipline, in terms of commitment, the continuation of development, personal development, acting with integrity. And again, if you think about the relationship between this and uncertainty, this is actually pushing you back to think about what you can do at this point. You will not be able to react to act in a wise manner in accordance to this changing environment if you're not really sure about what your values are. All right? How many? Okay, so I'm being encouraged to move on. Again, working with others, being part of teams. We all are, by default, working within teams in healthcare. How can we become more effective team members? This is the second element. How do you manage the services? Again, you don't have to be a manager to manage the services. You're always entrusted to doing a task. How do you do your task? How do you think about doing your task more efficiently and allocating your time to the right task and helping your managers understand where you can actually be of the most help, which includes planning, managing resources, and managing people. And all of these, again, you can think of all of these being done at all levels of the organization. It doesn't have to be done, it's not just done by the managers and the leaders of the organization. Again, improvement, thinking always about how do you improve your performance, improve your service, improve your utilization of the resources under your authority, and setting direction for you, for the department you're working for the organization you're leading. So these are core 5 domains that are relevant to everyone in the organization, as we mentioned. And they're relevant to everyone all the time, but they're especially relevant in times of uncertainty. The focus should always be on what can be done and what's my role as an individual. What do I care about? All right? The two remaining themes are mostly around, geared towards top leaderships and organizations. And the most important of which is creating the vision. And I wanted to actually spend maybe a little more time on these two because they really, are sort of related to the macro level stuff that we discussed. First is developing the vision for the organization, and the key word here actually is engaging people. So even if I am as a leader of a unit or a leader of a hospital, I'm not sure about what's going to happen next year or the year after. First thing I could do is engage my colleagues at all levels of the organization to try and think as a group what we can do, what our priorities should be, what our plans should be going forward. And the rest of this is basically understanding the context around you, being innovative and bold about your goals, and also sticking to your core values. I think this is one of the points that sometimes we underestimate. I think having dialogue, not just with with colleagues and people reporting to you as a leader, but also with people outside in the system. I think, especially in our society, we have significant amount of informal relations, friendships, past, relationships at work. That we should really leverage to start up or to set up the dialogue and the conversation around these major issues that we talked about. We all have opinions, we all have values, so we need to communicate that with the colleagues, people who have who are actually on the table for designing these things, because they would like to hear actually the report, the input from people on the ground, from people who are managing things on a day-to-day basis. So that's the key factor, and I think this is something that all of us can do and should try to do as much as we can. And again, communicating the vision, going back to the idea of being clear about your own values, about the values of the organization, and engaging all the stakeholders in the organization to transfer that passion about the value and passion about the vision to the rest of the organization. Yep, and then embodying the vision obviously through establishing as Dr. Suhail was saying, is establishing an engine for building that vision in the organization. It's not just a statement that you say, or that you write, or that you post. The other relevant part is delivering the strategy, and this comes obviously after clarity has set. But again, even in uncertain times, the work on the strategy should be there, should start. And again, it doesn't have to be something that is imposed on us. It has to be something that we initiate, that we start, that we think about, that we try to develop even in informal ways. But the process itself of trying to frame the strategy, trying to develop the strategy, trying to deliver the strategy, and thinking about all these elements, even if you haven't really formally started the process, is quite important. I'm not sure about the time, but maybe we're about to close. But if you actually go back and think about this all, you can summarize it in maybe 3 or 4 points. First, as a leader, you will need to know yourself first and foremost. You will need to know your team. You need to know your organization. You need to know the context around you. You need to engage. Again, engaging yourself and reflecting and understanding your values. Engaging your teams in dialogues to convince, to motivate, to inspire. Engage your leadership for ideas, for insights, for feedback, and engage the context around you, right? And then you have to have initiatives and be proactive and reach out and throw ideas. Well, that's it. And thank you very much for your hearing, for your listening, and we're more than happy to